Mr. Joshi.
Good morning, Mr. Dan.
How's it going? Pretty well. What would you like to ask me today?
Well, I was wondering, what exactly is Crohn's disease?
Crohn's disease is when inflammation occurs on the inside of the GL tract. The GL tract is a series of organs connected from mouth to anus to make the digestive system run properly. Crohn's disease is inflammatory bowel disease, IBD. It causes inflammation and irritation to the intestines. Crohn's disease is hard to diagnose because it is very similar to other digestive diseases.
Well, that's very interesting. Who exactly gets Crohn's disease?
Crohn's disease affects men and women equally and seems to run in some families. People with Crohn's disease may have a relative, often a brother or sister, with some form of IBD. Crohn's disease occurs in people of all ages, but it most commonly starts in people between the ages of 13 and 30. Men and women who smoke are more likely than non-smokers to develop Crohn's disease. People of Jewish heritage have an increased risk of developing Crohn's disease.
Well, that's also very interesting. What exactly is the cause of Crohn's disease?
The cause of Crohn's disease is unknown, but researchers believe it is a result of an abnormal reaction by the body's immune system. Researchers believe that in Crohn's disease, the immune system attacks bacteria, foods, and other substances that are actually harmless or beneficial. During this process, white blood cells accumulate in the lining of the intestines, producing chronic inflammation which leads to ulcers, sores, and injury to the intestines.
Oh, so is there like any other names for Crohn's disease?
The common name for Crohn's disease is obviously Crohn's disease. The medical name is inflammatory bowel disease. Other names for Crohn's disease is colitis or enteritis. Thank you for your time, Mr. Joshi.
This here is a diagram of what the colon would be like with and without Crohn's disease. This is how it would be when it was inflamed. A normal colon would look more like this.
Welcome to Metaphiles, Episode 2, Crohn's disease. Today we will welcome Mr. Joshi, our new expert.
Hello, Mr. Kumar.
Hello, Mr. Joshi. How are you doing today?
I'm fine. How about you?
I'm good. I would just like to know about the diagnosis of Crohn's disease because I was wondering what are the diagnoses?
Well, first, doctors will do blood tests to test anemia. Stool tests are also used to rule out other GL diseases like infections. They can also show if there is intestinal bleeding. A flexible sigmoidoscopy and a colonoscopy help see how much of the small intestine is infected and help view the colon and small intestine.
That's very nice to know. Also, I'd like to know the symptoms of the Crohn's disease, like for people who have Crohn's disease, like what are the symptoms?
Well, if you have Crohn's disease, you will experience persistent diarrhea, rectal bleeding, an urgent need to move bowels, abdominal cramps and pain, sensation of incomplete evacuation, which is poop, constipation, which can lead to bowel obstruction, inflammation of the GL tract, and pain in the lower right side. General symptoms that also may be associated with IBD is fever, loss of appetite, extreme weight loss, fatigue, night sweats, and your loss of your normal menstrual cycle.
Oh, that's horrible for the kids who have Crohn's disease. I wish I never had Crohn's disease. What are the treatments to like cure Crohn's disease or like to help the people?
Well, unfortunately, there is no cure for Crohn's disease, but the main treatment for Crohn's disease is just to give them medicine to stop inflammation in the intestine and other medicines to prevent flare-ups and keep you in remission. Medications, nutrient supplements, and attempting to alleviate abdominal pain along with diarrhea and rectal bleeding are also there for you. The doctor will most triggers your signs and symptoms. It is also to improve long-term prognosis by limiting complications. Thank you for your time.
Thank you, Mr. Roshi.
This here is a diagram of the large intestine of a person with Crohn's disease. As you can see, in some certain spots, there are inflamed parts. This is what your large intestine would be like if you did have Crohn's disease. The different parts is the transverse colon, which is the top part, the ascending colon, which goes up across this side, and the descending colon, which goes out and leads to your anus and rectum. The appendix is very close to one spot where Crohn's disease affects your large intestine. You can get ulcers in your large intestine over here, in these spots. This is called Crohn's colitis. Go.
Welcome to Metaphiles Part 3 on Crohn's disease. This is your host, Paul Yin. Today, we will welcome Mr. Kumar, our food expert. Welcome, Mr. Kumar.
Thanks, Mr. Paul.
Okay, today I would like to know what you should eat during Crohn's disease for breakfast.
For breakfast, there's a lot of items that you can eat. Almond milk, eggs, and oatmeal. Almond milk is eaten for breakfast because since many people who have Crohn's disease are lactose intolerant, they should drink almond milk, which is an alternative to regular milk. They should eat eggs because eggs are inexpensive source of easily digested protein. This will help the people with Crohn's disease cheap food that are easily digested. They should also eat oatmeal. Oatmeal can help in diarrhea for people with IBD.
Well, very nice. What should people with Crohn's disease have for lunch?
Lunch. Well, there's vegetable soup, avocado, and there's also butter lettuce. People with Crohn's disease should eat vegetable soup because vegetable soup is good for people with Crohn's disease. Pure veggies like pumpkins, butternut squash, carrots, parsnips are fine. And you won't lose nutrients like you do when vegetables are boiled. Avocado. Soft, smooth, and chock full of good fats, B vitamins, and vitamin E. Also, there's potassium. Avocado should definitely be on the menu if you have Crohn's disease. People also eat butter lettuce because as long as you're not experiencing severe diarrhea, you should be able to enjoy a salad made from butter lettuce.
That sounds like these people are very, very healthy because their whole meal is probably lettuce, fruit, and vegetables. What would you eat during dinner?
Dinner. That's a good question. There's salmon, poultry, roasted red peppers, and rice. 25% of the calories you eat should come from protein, which is a key for people with Crohn's disease to get better. This is for people who eat salmon. Poultry. They're easy to digest, making them go-to protein source for anyone with IBD. Roasted red peppers. Brilliant and super tasty. Roasted peppers with skin removed are delicious nutrients and safe for people with Crohn's disease to eat. Rice, a traditional choice of anyone who's suffering from stomach growls. White rice and other refined carbohydrates may not be super nutritious, but they're easy to the gut. They can also provide the calories the people with Crohn's disease need during challenging times.
What would you eat when you need a snack?
For snacks, let's see. There's papaya, smooth nut butters, and pure beans. Papaya contains an enzyme, papain, which helps your body digest proteins. This butter soft fruit is also rich in vitamin C and vitamin A. Also, there's folate and potassium, and is available year-round. Let's talk about smooth nut butters. Smooth nut butters are an excellent source of good fats. There's vitamin E and lots of protein, but digesting them presents an unsurmountable challenge to most people with Crohn's. Pure beans. Pure chickpeas is the main component of hummus, and while pure lentils are
terrific source of lean protein and other nutrients, and should be safe even if people with Crohn's disease are eating them. We chose this menu so that it could help people with Crohn's disease. Very, very interesting. Thank you, Mr. Kumar.
Thanks, Mr. Yan.
And to the audience, see you next week when we talk about sickle cell disease. Bye!
This is the diagram of a person. In this video, you have heard the word bowels a lot. The large bowel and small bowels are over here and out here. The areas most affected by Crohn's disease are these two areas.